Okay, so now we're going to get started on some questions to go through. I also made a quiz, so make sure you go through the quiz. All right, so the nurse is developing. Sorry about this bright light here. I'll try to sit back here. The nurse is developing a plan of care. All right, so you're making your plan. All right, so you're setting goals for a patient who has hypoxia. What is hypoxia? They have a low oxygen level. They have been admitted for increased oxygen needs above a baseline of 2 liters. That's what you're going to set your oxygen to, 2 liters. The nurse develops a goal stating the patient will have oxygen saturations of greater than 98% on room air. That means without oxygen at the time of discharge from the hospital. What is wrong with this goal? So remember, our goals need to be realistic, measurable, centered, comprehensive, detailed. So let's look at this. So is it measurable? Meaning, is there any specific numbers in there, or by this day, or by this in 2 weeks, or by Monday, which is 3 days from now? All right, so the patient will have oxygen saturated greater than 98%. So it seems like it's measurable. So we have the greater than 98%. That's specific. It's not saying the patient will have increased oxygen levels by the time of discharge. That would not be measurable. Okay, so we have that. Is it patient-centered? So what do you think? It looks like they have oxygen saturation, so the patient will, at the time of discharge. So it's patient-centered because you're talking about the patient. Is it realistic, though? So if you look back, this patient has hypoxia. He has increased oxygen needs. So what do you think about 98%? I told you on the last slide that 95 to 100 is normal for healthy people, but if you have chronic lung disease or anything other than that, it may, and plus remember, we discharge from the hospital pretty quick these days. It might not be realistic to have an oxygen saturation of greater than 98% on room air. So we have to think about that when you're making your plans. So if you made something of like greater than 94% on room air, that would most likely be more realistic for the patient to achieve that goal. Which is a correctly written goal by the nurse? All right, so this question's easy to break up. What one's correct? All right, and goal by you. So you're writing the goal, and which one did you write that was correct? Patient will administer the prescribed dose. Patient will learn to administer insulin. Patient will know how to take insulin correctly. Or patient will independently administer the prescribed dose of insulin at the end of 1 hour of instruction. So going back to the last question, is it measurable? Is A, B, and C measurable? No, they're not. They would wipe out A, B, and C right away because there's nothing to say specifically. So you'll administer the dose. Well, what's the dose? You'll learn to administer insulin. Well, how and by when? And then you know how to take insulin correctly. Well, how and when? All right. Is it realistic? And is it patient-centered? So all A, B, C, and D are all patient-centered because it's talking about the patient. Are they realistic? Well, we don't really know if A, B, and C is, and it's really not because it's not specific enough. So D is the correct answer. It looks like patient will independently administer the prescribed dose of insulin at the end of 1 hour of instruction. So that would be a realistic goal for somebody that's doing a one-on-one 1 hour teaching. A patient will be sent home with a metered dose inhaler, meaning like an albuterol inhaler, and the nurse is providing teaching, which is a correctly written goal for this process. All right, so you are the nurse. Put yourself in the situation. You are teaching a patient. You gave him this albuterol inhaler. All right, and you need to make sure that there is a correctly written goal to teach this patient how to use it. You want them to learn. So what's the best answer? The nurse will demonstrate the correct use of a metered dose inhaler to the patient. What do you think about that? If you demonstrate it, the patient's not really learning, because we do know active learning is important, and we need to show repeat or the patient needs to do it. Plus, you don't really want to use their inhaler, right? All right, the nurse will teach the inhaler how to administer medication with a metered dose inhaler. But is that really measurable? How? When? By when? The patient will know how to self-administer the medication using the metered dose inhaler. Okay, well, that's a little bit better. But they'll know how. But how do we know that they know how? So let's go to the last one. The patient will independently administer the medication using the metered dose inhaler at the end of the session. So that obviously is the correct answer, as you probably figured out by now, because it's measurable by the end of the session. It's realistic by the end of the session, and it's patient-centered, and we put independently administer so we know we can reach that goal. A patient who's hospitalized for asthma wants to go home. You, the nurse, and the patient talk about the patient's situation and decide that the patient may go home when able to perform self-care without dyspnea and hypoxia. This is an example of what nursing process. You can see the answers on the top, but let's go through this. You're reading this question, so put you in the position. Redo the question in your mind, so you make sure you have it understood. All right, a patient wants to go home. She has asthma. She wants to go home. So you need to talk to her and see it and talk to her, and you want her to be able to brush her teeth and get up and get dressed without being short of breath and having a low oxygen level. That's dyspnea and hypoxia, short of breath, and hypoxia, the low oxygen level. All right, so what are you going to do? You are going to make a plan with her, right? So you're going to do some planning and make some goals for her. So this could be the exact goal. The patient will be able to be discharged from home and able to brush her teeth and get dressed this morning without having any shortness of breath and an oxygen level greater than 94%, let's just say. So you can see, and you can say independently also in there. All right, so which information, now we're going to implementation. Now we're actually carrying out the plan or your goals that you made. Which information will the nurse include in patient teaching? All right, A, cost of drugs, administration technique. So you probably would put that in there, correct? And how are they going to take it? Let's just say you are sending someone home with a piece of paper or a prescription for amoxicillin. And so you're going to say, all right, you're going to take this by mouth, all right, with a sip of water or a couple sips of water. C, instructions regarding drug discontinuation. Yes, you're going to take it for 7 days. So after 7 days, you'll be done with it, but you have to make sure you take every single dose. D, foods to avoid when taking a certain drug. Yes, you're going to look that up, and it'll say take with food, or if there's any implications. You can say with amoxicillin, just make sure you take it with some food, because that will help with preventing nausea. E, side effects to report to healthcare provider. You would look up the side effects, and you would say if you get any like diarrhea that won't go away, vomiting, a rash or hives, you really need to call the doctor and let him know you're having that. So looks like B, C, D, and E, but I'm taking out A because we don't know how much the drugs cost. Every pharmacy is different, so you have to just tell them, I don't know what the cost of drug is. So it really doesn't include in the patient teaching because you don't know how much drugs cost. They need to go to their pharmacy or they need to call and find out. What's the first step in the nursing process when working with patients receiving drug therapy? All right, so we have assessment, planning, implementation, and evaluation. So what's the first step in the whole process? It's assessment, right? All right, so this one should be easy. Know that they go in order. So there's nursing diagnosis that goes in between there too. All right, before information about drug therapy is presented, to a patient, it's most important for the nurse to determine the patient's reading level, plan the number of sessions, assess the patient's readiness to learn, or tell the patient he or she must comply with the drug therapy. I'm going to take out D because that's basically bossing them around and saying and directing them to do something. That's not going to make them want to take their meds, right? So I'm taking out D. Let's see. Plan the number of teaching sessions. I don't know yet at this point because you don't know their readiness to learn. Are they even ready to learn yet? And then you can determine what their reading level is. So that's the first thing. Are they even ready to learn? Maybe you walk in there like, get out of here, which can happen. So you can't find out any of that stuff. In caring for groups of patients, the nurse makes every effort to respect patients' preferences and values. Which CUSIN competency does this action reflect? So you're seeing a group of patients. You want to respect patients' and preferences and values. So this is about the patient, right? So this would more or less be patient and family-centered care. Collaboration and teamwork would be working with your other team members. Evidence-based practice, we talked about that's more advanced practice nurses, and quality improvement is making sure what you're doing is working. That's like studies and stuff. Which this is the explanation. So recognize the patient as a source of control. So that's very important. And I said that again. All right, John cannot afford his medication. You call the social worker in an elderly care agency in town. What CUSIN competency is this? All right, so John, you have John. He can't afford his meds, and so you're going to help him out by reaching out to another agency. So you're going to call the social worker and the agency, and you're going to work together. So what is that? Collaboration and teamwork. The nurse administers a first dose of an antibiotic, and upon returning to the room, you go back in the room, makes an observation of the patient as a portion of the assessment process. Which finding is objective data? So you're going in there and you want to make sure that they, and usually with opioids meaning morphine, Vicodin, those kind of things, it's required for you to go in and make an assessment after you give them a dose. So you're observing them, all right? And so it says observation. That separates it. You're not asking the patient how they're feeling, you're observing. So which findings would apply? So lung sounds clear. Is that something that you're doing or the patient's telling you? So that's you. So that's an answer. Skin free of redness. Do you see? Are you observing that? Yes. So the skin is free of redness. Patient complains of itching on leg. That's what he's telling you. So that's not objective. That's not your objective portion. Denial of pain. That's him telling you. So that would go in the subjective part. 1+ pitting edema in ankles. That's you are assessing that. So try to get that subjective, objective, what you are observing and what you do versus what the patient's telling you. So the answers are A, 1, 2, and 5. The nurse is developing a nursing care plan for a newly diagnosed adult male patient with hypothyroidism. All right, so you're making a care plan for this patient who's a male with hypothyroidism. His thyroid's not functioning as well. He has many questions about his diagnosis and medication. What nursing diagnosis would be most appropriate? So basically you sit down with this patient and you're making a care plan and these goals, and he keeps asking a lot of questions. He has a lot of questions about medicine. I don't know what this is doing. What do you mean? What is hypothyroidism? I don't understand this. He just really doesn't know anything about it. So at this point, with what you know on the question, what's the best nursing diagnosis? Would it be excessive fluid volume related to hypothyroidism? No. Ineffective coping related diagnosis? Could be. Risk for deficient fluid volume? No. Risk for ineffective therapeutic regimen management related to new diagnosis. Okay, so Let's go back to the question. He has many questions about his diagnosis and medication, and he was newly diagnosed. All right, so he's just diagnosed. So I'm going to take out ineffective coping related to diagnosis because he was just diagnosed with it, and so it's not like he has diabetes and 6 months later he's coming back and just not knowing anything about it. That would be ineffective coping because he's probably gone through teaching already. So I'm going to put risk for ineffective therapeutic regimen management. So how is he going to manage this whole thing related to this new diagnosis? So he's at risk for that because he seems like he has a lot of questions and he's a little bit overwhelmed. So is he going to be able to manage this new regimen? Is he going to be able to understand why he needs to take this medication? And he's going to accept it. And this explains exactly how it is. So you can look at the slides and read about that. A female's taking a medication that can cause increase in fatigue and dizziness. So choose a diagnosis. All right, so she's taking a medicine that can cause tiredness and dizziness. Deficient knowledge related to drug side effects. Probably not, because you probably told her. Deficient knowledge. Readiness for enhanced knowledge related to med side effects. A risk for injury related to side effects of the med. Alright, so it looks like she already knows that she can have an increase in fatigue and dizziness. And so deficient knowledge, I'm going to say no, because you told her. Readiness to enhance knowledge related to med side effects. And that's already been given. She's already been given the medication, and she's already taking it. Risk for injury. So I'm thinking more safety, because if she's tired and can get dizzy from this medication, maybe she's at risk for falls. So I'm going to go with the safety portion of it. You're looking over the patient's chart for the social history to see if there's a past history of alcohol use. What nursing process is this? So you're looking in the patient's chart for social history. So what is that? That's going to be your assessment. Okay, because you're going in there and you're assessing to see if they have a past history of alcohol use. You as the nurse are writing a blood sugar log with the patient to take their medications at the correct time. What is part of the nursing process? What part is this? You're writing a blood sugar with the patient. That would be what? You're planning, you're making goals. All right, and that is it.